coronal suture, sagittal suture, bregma, and here we have occipital bone, lambdoidal suture, and this is lambda. This is lambdoidal suture around the occipital bone. This is occipital bone until here. Occipital bone, foramen magnum within the occipital bone. External occipital protuberance, external occipital crest between the magnum and the protuberance. Superior nuchal line, inferior nuchal line. This is foramen magnum. This is another part of the occipital bone which is called occipital condyle, condylar canal. At the lateral aspect we have squamous part of temporal bone, greater wing of the sphenoid bone, frontal bone, sphenoid bone, temporal bone, parietal bone. This area, H-shaped area, is called pterion. This is overlap the middle meningeal artery. That's why it has clinical importance. During trauma, during accident, the artery may traumatize. This is frontal bone again. This is roof, upper border of the orbital cavity. This is orbital notch, supraorbital notch, supraorbital foramen, supratrochlear foramen. Nasal bone. This is nasal cavity. Here we have inferior concha and middle concha. This is nasal septum. The upper border we have perpendicular plate of ethmoidal bone. Lower border we have the vomer bone. This area is called anterior nasal spine. This is maxilla. This is infra-orbital canal. This is maxillary bone which contain the maxillary sinus. And this is alveolar bone or alveolar process of maxillary bone which carry the teeth. This is zygomatic bone. This is zygomaticofacial foramen. This is zygomatic arch. The zygomatic arch formed by three parts. Zygomatic bone in the center, zygomatic process of maxillary bone, and zygomatic process of temporal bone. This is external acoustic meatus. Mastoid process, styloid process, again two parts of the temporal bone. Kata temporal bone la chi pekatwa lerea, squamous part, mastoid part, styloid part, and tympanic plate. This is tympanic plate which surround the external acoustic meatus or external auditory canal. This is mastoid process. This is styloid process. Between the styloid process and mastoid process, we have stylomastoid foramen. External acoustic meatus. It forms part of the wall of the external acoustic meatus. The orbital cavity, as we see, we have the roof, the floor, lateral wall, and medial wall. The lateral wall, here we have greater wing of the sphenoid bone. We have lesser wing of the sphenoid bone. Between the lesser wing and the greater wing, we have superior orbital fissure. او فيشر جوريا حكاية بيني greater wing and the lesser wing. Above medial to it, we have optic canal. Optic canal. Optic canal located within the lesser wing of the sphenoid bone. كواتا أو فراميني كلنا أو بونيا بيالن optic canal. كواتا now lesser wing of the sphenoid bone. Between the lesser wing and the greater wing, we have superior orbital fissure, as we see it. It is large fissure. At the floor, we have inferior orbital fissure. This fissure is inferior orbital fissure. Between the maxilla and greater wing of the sphenoid bone, between the lateral wall of the orbit and the floor of the orbit, which means the maxillary bone, this is maxillary bone, passed to the floor of the orbit. Between this part of maxillary bone and greater wing of the sphenoid bone, we have inferior orbital fissure. Just in front of the inferior orbital fissure, we have groove, as you see it. Infraorbital groove, from its name. Inferior orbital fissure, infraorbital groove, pass to the infraorbital foramen. The infraorbital foramen is the continuation of the infraorbital groove, which arises from the inferior orbital fissure. يعني بمشي هو inferior orbital fissure, infraorbital groove, infraorbital foramen. There چی درجة infraorbital nerve, which is the continuation of the maxillary nerve. Maxillary nerve, it is one of the branches of the trigeminal nerve. Medial wall here, we have this sac or this space, this fossa. This fossa is called lacrimal fossa or lacrimal sac. This is the area at which the tears are collected. There چی کوبیتو tears فرماس كاكو بوا لعبة يتخوارو بو بشاي لود بلا بشي خوارو ياكليتو بو يدكتيكو كبيلا نيزو lacrimal duct. خوي lacrimal gland كويت ايرو للاترلا بس بو يدكتو يتم بشايو ليو يتخوارو. طبعا ليريا چمبون اكمان هيا. Behind the lacrimal sac we have lacrimal bone, and more posteriorly we have ethmoidal bone, which is called orbital part or labyrinthine part of the ethmoidal bone. أو إلى نظرك يا باس مانكل. كواتا تشيتيا lacrimal bone, ethmoidal bone, and more posteriorly we have sphenoid bone. We have number of processes in the skull. As we see, we have this process arise from the frontal bone. This is called zygomatic process of frontal bone. Zygomatic process, zygomatic process, because it passed through the zygomatic bone. That's why it is called zygomatic process of frontal bone, originated from the frontal bone. And this one is arise from the zygomatic bone, but passed toward the frontal bone. Labaropialan, frontal process of zygomatic bone. Frontal process of zygomatic bone. And the suture between them is called fronto-zygomatic suture or zygomatico-frontal suture. And so on. This is between maxillary bone and zygomatic bone. This is between temporal bone and zygomatic bone. These are sutures. This is, as we said, the vault of the skull from outer side, from outer surface. If you look at the inner surface of the vault, internal feature of the vault, you can identify this large fissure or sulcus. This is called sagittal sulcus. Sagittal sulcus contain or occupy the superior sagittal sinus. Superior sagittal sinus is one of the dural venous sinuses. It is large or big sinus contain the fluid which is called CSF, cerebrospinal fluid, extended anteriorly from the frontal bone and posteriorly toward the occipital bone. لشوية كوتايت, the end of the sinus, near the internal occipital protuberance. Internal occipital protuberance. And started nearly at the anterior to the crista galli, or anterior to the foramen cecum. Gutman, superior sagittal sinus. At both sides of the parietal bone inside internally, we have these grooves for the middle meningeal artery. The parietal bone contain the grooves for the middle meningeal artery, which is branch of the maxillary artery. Enter the cranial cavity through a small foramen. لرقا forameni بچوكو middle meningeal artery كبريتيا ليكيك دا برانشكاني maxillary artery يتناو cranial cavity ولا ديويناوي parietal bone كان opposite to the inner side of the parietal bone. Within the skull we have small foramina. These foramina are called emissary foramen. Emissary foramen. They are mainly present in the parietal bone and mastoid bone. لدو شويني رئيسية هي. The parietal bone لقل mastoid bone. إيش يعني شيء هم emissary foramen أنا؟ They connect the nerve, artery, vein between the intracranial cavity and extracranial cavity. في عنا emissary foramen يعني emissary canals. ليرة هي لقل area بزوري. أو فينا ساينساني كبازة كريتا مجاري إشارتي بيانا چيا بريتيا لفيني چي قورا بونمونا وكو فيناكا چوانيا پرديه طبعا او ديواريه وكو تيوبيك وايا او تيوبيكا ديواركاني بريتيا لديورا ماتر ديورا ماتر بويا بيالان ديورال فينس ساينس ديورا ماتر او كوبوتو خربوتو چاردوري فيناكي او شتيكي دروس كردو بيالان فينس ساينس بيالان ديورال فينس ساينس يكيك لوانا بريتيا ل superior sagittal sinus superior sagittal sinus كاكيت ناو sagittal سلكسا عملية لنا يأتي لبرشي بيشويات برودو middle meningeal artery it's not sinus هز بسيارين يا